Hi there. My name's Dr. Bloom. I'm going to be performing your annual physical exam today. Alright. If you could just please have a seat, I'm actually going to be asking you a few questions before we get started. Now, I know that they already got all of your basic information up at the front desk, but I'm mainly going to be asking you about health history questions and how you feel at the moment, alright? So, have you had any major medical conditions in the past, such as cancer, high blood pressure, that sort of thing? No, okay. And are you currently on any medications? Great. Okay. Do you know if anyone in your family has had any major medical conditions that you know of? Okay. And is there any health concern that's troubling you at the moment? Okay. Okay, I'll have a look at that then when I'm doing your physical exam. So it's just a little mark on your cheek that's been there for quite a while? Okay, we'll take a look at that then. And how are you feeling overall? Are you experiencing any nausea, headaches, sore throat, stuffy nose, anything of that nature? No? Okay, great. So what we're going to be doing today is first I'll be taking your blood pressure to make sure everything's okay there. And then I'll be gauging your heart rate and your respiratory rate, and then I will take your temperature, and from then we'll move on to various systems of the body. So I'll be checking your eyes, your ears, your skin, that sort of thing. Alright? And there's really nothing to be nervous about. This is just a routine exam, so yeah. I'm going to take a quick moment here to look at your chart, just to kind of get an accurate gauge of what your previous readings have been for other appointments, so I can kind of compare and contrast, okay? Okay, just give me a moment. Alright, it doesn't look like anything was out of the ordinary in the past, so go ahead and get started with your exam now. I'm actually going to go ahead and put on some gloves, and you don't have any latex allergies, do you? Okay, great. Okay. I'm going to go ahead and take your blood pressure now. So I'll just need you to sit still for me and just relax as much as possible. I'm going to put the blood pressure cuff on your arm, and then we're going to take the reading, okay? Great. Okay, looks like everything is normal. The rates are a bit high, but that's usually the case for someone who's a bit nervous about their physical exam, so I'm not really concerned about that. Okay, now I'm going to get out my stethoscope and I'm going to place it right here on your chest, and I want you to take a deep breath in for me and then out. Take a deep breath in and out. Okay, I'm going to go on the back here. Take a deep breath in and then exhale for me. And then take a deep breath in and out. Everything looks great so far, so your lungs sound nice and clear and your heart rate's great, so those are two key things that I always look for. Okay, I'm going to go ahead and take your temperature now. Just get a fresh fresh thermometer. Yeah, we use different attachments for each patient just in case, of course. We used to sterilize them in between, but now we just use individual ones for each patient. Okay. I want you to open your mouth, and I'm going to put it right there under your tongue. Okay, and we'll wait just a minute to get the temperature reading, okay? Okay, let's take that out then. And yeah, 98.8, so that's right in the average range. That's great. Okay, the next thing I'm going to do, I'm just going to go ahead and check both of your ears. So let me start with the right ear. See if there's any wax buildup or anything in there. Make sure everything's clear. Do you have any difficulty hearing or anything? No? Okay. I'm gonna whisper into your ear and just let me know if you can hear it, okay? I'm testing your right ear. Were you able to hear that? Okay, great. Now we'll go on to your left ear. Let me take a look in there. That looks clear as well. Seems a little bit irritated. Do you use Q-tips? Okay, try not to go into the ear canal when you do that, as that can irritate the ear canal. Okay, let me try whispering here. I'm testing your left ear. Were you able to hear that? Okay, wonderful. I'm going to come back around in front here, and I'm going to test your eyesight. So I'll test the vision in your right eye first and kind of assess the eye, make sure there's no discoloration. Okay. Just go ahead and make sure to hold your eye open for me as best as possible. Alright, that eye looks good. And let me see the left eye now. Okay. And that one looks good as well. Okay, great. face, I'm just going to make sure that everything kind of lines up, that your jaw's kind of not out of place and everything is kind of, yeah, that your reflexes are good too. Can I have you raise your eyebrows for me, please? Okay, and then kind of smile for me. Just a closed mouth to smile first. Great, and then go ahead and show me your teeth. Okay, that's all good. And let me have a look at your sinuses. I'm just going to press my fingers along the bridge of your nose here just to make sure there's no pressure built up. Okay. Do you usually have any difficulty breathing? No? You do have allergies. Okay. Wonderful. Alright, now I'm just going to kind of check your skin, the skin on your face, and then kind of in the neck area I'm going to just do some, I'm just going to apply some light pressure on your neck just to make sure that the lymph nodes aren't swollen, okay? Okay, the skin on your face, everything looks good. No red blotchy areas or anything, and then your neck. Lymph nodes feel just a bit swollen. Did you recently have a cold? You've been fighting one off for a while. Okay. Yeah, that would be the reason for that then. Alright. Okay. Okay, I'm now going to have you just kind of lay back on the table for me. Okay, and I'm just going to lightly apply pressure to your abdomen. I just need to make sure there's no swollen areas there either, okay? Have you had any stomach aches or anything recently? No? Okay. Okay. Left side of your abdomen. Alright, everything looks great there. Okay, you can go ahead and sit up again for me. Yeah, we just do that just to make sure that that your liver isn't disproportionate and that also there's no abdominal fluid in there, okay? Okay, one last thing. I need you to open up your mouth for me. Okay, I need you to say, ah. Yeah, we always make you say that, huh? Ah. Okay. Yeah, it looks like your throat's good. There's no irritation, no redness there. Okay. Okay, we're all set with the physical exam then. Did you want me to take a look at that mark on your cheek, right? Okay, let me go ahead and... No, it doesn't have an abnormal shape or anything, and it's not too discolored or anything. I wouldn't worry about it. If it does get any bigger, or if you notice the edges of it are getting kind of misshapen, I would schedule an appointment to see a dermatologist, and I can refer one to you if you need to, okay? Yeah, it looks fine at this point. I wouldn't worry about it. Okay. Now I was going through your chart, and I noticed they have you on Prevacillin for your allergies. Was that working okay for you? Are you still experiencing allergy relief from it? That's okay. Okay. I know that sometimes we can build up an immunity to it, so I always like to double check just in case. Did you need some refills for that? Okay, I'll write you out a prescription right now then. Alright, there you go. Okay, well you're all set. Yeah, I'm officially giving you the clean bill of health, so you're good. And, yeah, like I said though, if you do find that your allergy medication isn't working as well anymore, yeah, feel free to give me a call. And also, if you notice that mark is getting any bigger or misshapen, please do get a hold of your dermatologist as soon as possible, okay? Yeah, I think you're fine for now. It's very small, so you're good. Alright. It was great seeing you, and yeah, you have a great rest of your day. Okay, bye.